Welcome back. Still tuned in to News and Views with myself, Salailo Makudir. The time is 17 minutes past 8 Central African time. It's a very beautiful morning here in Johannesburg, and we're glad that you're able to join us for today's edition of News and Views. As I mentioned before we went to the break, we're going to be kickstarting the show with a very, very important topic. South Africa has been hailed as a global success story when it comes to the fight against HIV and AIDS, but the hard-won progress may be under threat. Undocumented migrants and asylum seekers are now being turned away from government clinics and hospitals. And with the new NHI Act, potentially limiting their care to emergencies and notifiable diseases, the problem? HIV is not classified as a notifiable disease, despite infecting 400 people a day. Activists warn that this policy, combined with a largely xenophobic kind of approach at clinic gates, could undo decades of progress. And joining us now is Section 27's Executive Director, Sasha Stevenson. Sasha, good morning. Thank you so much for joining us. I really appreciate you giving us your time to unpack this very, very important and concerning topic.
Good morning. Thank you.
I think we can begin here. Why is HIV not listed as a notifiable disease in South Africa, given its large scale and the impact that it has had for so many years?
So there are various reasons that the conditions that are listed as notifiable conditions include things like tuberculosis, cholera, COVID, conditions that need to be very carefully monitored and that can spread quickly. HIV hasn't been included on that list for a number of reasons. The first is really that there is real concern about stigma. Stigma was a huge problem towards the beginning of the HIV epidemic, but it remains a problem today. And there's a concern that if there is a kind of noting down of people who have contracted HIV and are going through treatment, that could increase the stigma that they face. But the other good side is that we actually have really good HIV surveillance systems already built into our health system. And so it's not necessary, in the same way as it's necessary for TB, for HIV to be considered a notifiable condition. So there are pros and cons to including HIV on the notifiable conditions list. It's never been a problem before that HIV isn't included on that list, and indeed it's been protective of people living with HIV. The concern now is that as government moves towards NHI, which seeks really to significantly regress access to healthcare services for categories of people, now suddenly there's this discussion as to whether HIV should be considered a notifiable condition and that people should be able to access treatment regardless of their documentation status under NHI.
And now I want to move on, I think, to something that's very, very concerning. The fact that the NHI Act in itself is being pointed to as the reason why undocumented migrants can't access HIV treatment. Can you break down exactly what the law says and what could potentially be some of the risks that could be associated with that?
Well, let me first tell you what the law says now. Because the NHI Act has been signed, but it hasn't been promulgated. It's not in effect. So that's the important thing to remember first. The law right now says that everyone, firstly, the Constitution says everyone is entitled to access to healthcare services. There's no citizenship requirement in the Constitution. The National Health Act furthermore says that everyone, unless you are on medical aid, is entitled to free primary healthcare services, so services at clinics primarily. And again, there's no limitation as to what your documentation status or your citizenship is. So everyone is entitled to services at primary healthcare facilities, which is where most antiretrovirals are collected, where most HIV tests are conducted, etc. So everyone is entitled to those services. Pregnant and lactating women and children under the age of 6 are all entitled to free healthcare services throughout the primary healthcare system and in hospitals. And refugees and asylum seekers are entitled to be treated like South Africans, which means they must be means tested for access to tertiary to hospital services. And undocumented migrants from SADC states are entitled to be treated like South Africans. So they must be means tested for hospital services. So really, The only people who are excluded from being treated in the same way as South Africans by law at the moment is undocumented people from other than SADC states. And of course, the majority of migrants in South Africa are from SADC states. So that's the first thing. The law right now is very clear. There was a directive in 2017 and another one in 2018 to say that everyone with HIV or everyone is entitled to testing for HIV, and it doesn't matter where you come from. And everyone with HIV is entitled to the treatment required. And that's for really good public health reasons. As you said, HIV doesn't distinguish between citizenship. And so it's important that we are treating everyone in the country, particularly in a country with the biggest antiretroviral program in the world. It makes all the sense in the world for us to be treating absolutely everybody, because that's the way that we control HIV in the country and make sure that it doesn't spread to citizens and non-citizens alike. So that's what the law says now. The NHI Act, on the other hand, seeks to regress. Now, constitutional rights need to be progressively realized, which means that's what it says in the Constitution. And that means that things must get better. There must be an increase in access. The NHI Act, on the other hand, seeks to decrease access for anyone other than essentially than South African citizens. So it cuts out asylum seekers, it cuts out undocumented people from SADC states from accessing healthcare services other than for notifiable conditions and emergency medical treatment. And that means that it cuts out people for accessing HIV treatment. And that is the problem.
How do you now respond to the argument that is, often made, especially from groups like Operation Tudula, who we have seen, reportedly targeting foreigners at clinics? When they say resources are scarce, we must look after South Africans first. How do you respond to that sentiment?
So yes, resources are scarce. And the reason they're scarce is because for the past at least 5 years, we've been disinvesting in our health system every year. The budget for health has gone down per person every single year for the last 5 years, except for this most recent year, where finally there was a shift in the austerity budgeting. So the reason that health facilities are under-resourced is not migrants. The reason is that government has stopped investing in health. And they've done that at the same time as they're talking about moving towards national health insurance. That's the first thing. The second thing is that there is always a massive overestimation of the number of migrants in the system. Quite a small percentage of people in South Africa are migrants, and a much smaller percentage are undocumented migrants. There are also a lot of South Africans who are not documented because we know the problems with home affairs, we know the problems with accessing ID books, etc., and even registering births of children. And so the assumption that, again, that the reason that the health system is under strain is because there's just so many migrants is just not true. Of course, in some areas there will be more migrants than others, but overall, it's not the case that migrants are the problem in this system. The efforts of Operation Dudula and March to March and Patriotic Alliance and Action SA and the other organizations and parties that are at the moment blocking access to migrants and to people who aren't documented from blocking access to healthcare facilities across Gauteng, some in KZN, some in the Western Cape and elsewhere. That blocking is totally contrary to the law, and it doesn't make public health sense. What we're doing is decreasing access to services and creating a situation where there will be more emergency demand for services. So really, it's an extremely unfortunate state of affairs, and something that we need government to take a stand on, because we're seeing the denial of rights, which is not allowed under the Constitution. And we're seeing a brewing public health problem. It's not for people to take those matters into their own hands when the law indeed is very, very clear.
And speaking of a brewing public health problem, I want to focus on HIV and AIDS, and how, this new state of affairs and the approach by organizations like Dudula and political parties like Action SA and them could potentially mean for HIV and AIDS response here in South Africa? Does it put South Africans in danger, and the migrants themselves?
Yes, absolutely. You know, the one thing we know very clearly about HIV is that remaining on treatment, or firstly getting tested timeously, is super important. It's important to know if you're living with HIV so that you can take action. And then getting quickly on treatment and remaining on treatment is really, really important. When you do that, you're able to suppress the virus, which means that you can't pass it on to anybody else. That is the way that we control our HIV epidemic in South Africa. HIV knows no citizenship, and it's certainly not the case that South Africans are only having sex with South Africans. It's absurd to think that we can only treat South Africans and that we will thereby be able to manage our HIV epidemic. We must also recognize that the health system at the moment is in a particularly difficult position because of the withdrawal of USAID funding, a lot of which was going to the HIV program. And so the system is now having to fill the gaps, and it's very difficult to fill the gaps when so much money has been withdrawn. So we're already seeing decreases in testing rates. We're seeing decreases in viral load tests. Those are the tests to see whether the virus has been suppressed so that you can't transmit it to somebody else. We saw, especially at the beginning, stockouts of antiretrovirals in some facilities as people were having to be moved around from facility to facility. So our HIV program is already under strain. And if we are to now cut people living with HIV out of the program, we really do risk an increase in HIV in the country. And that's not something that we can afford after years of really impressive work decreasing HIV transmission rates in the country.
Just lastly, before I let you go, Sasha, what remedies or interventions should government urgently be putting in place to prevent exactly what you're talking about, backsliding on some of the gains that we've made when it comes to combating HIV and AIDS?
There's a few things. What government needs to do first is be very clear about the unlawfulness of blocking access to healthcare services. They need to be clear about that in public statements, and they need to be clear about that by complying with their obligation to prevent any blockages. And that might include the police assisting at healthcare facilities. It might include just more support to healthcare facilities to make sure that nobody from the outside is blocking that access. That's probably the most urgent thing that they could do. The second is to work harder, essentially, to fill some of the gaps in the healthcare system that have been left by USAID funding being withdrawn. There's finally been an announcement that there will be an injection of funds into the healthcare system, but there's been very little transparency about where those funds are going. And it's important that they go to the places that they are needed most to fill some of the gaps that have been left by the withdrawal of that funding. And that includes things like peer counseling. It includes the data capturers that are all being paid for by PEPFAR that ensure that we're able to have surveillance of our HIV program, etc. So that cash injection needs to happen soon, and we need to know where it's going. And the third thing is that government needs to amend the NHI Act to make it very clear that there will not be a regression in access to services for refugees, asylum seekers, and the categories of undocumented people who currently access services. It's important for public health, and it's important for the realization of constitutional rights.
Well, there you have it, Sasha. Thank you so much for joining us. Really, really appreciate your time and for those insights.
Thank you.
There you go, Executive Director, Section 27, Sasha Stevenson, warning that fear, flawed policy, and xenophobia essentially could derail South Africa's fight against HIV and AIDS. But the question remains: can we afford to undo 2 decades of progress because of somewhat short-sighted health laws? And what do you think? You can engage with us. Do you think South Africa should be providing HIV treatment to undocumented migrants? Because ultimately, if we don't, the spillover will be onto South Africans. and this will derail all of the work that has been done, all the brilliant work that has been done. South Africa for so many years has been seen as world leaders and champions when it comes to combating HIV and AIDS. We have the biggest ARV rollout program in the world, and the only way we can maintain that is to make sure that everyone is tested, everyone is given the proper medication and care that they deserve. But people are saying, well, the resources are scarce. There's not enough to go around. And do you share that sentiment? Do you think South Africa should not or should be providing free HIV treatment to undocumented migrants, or denying them, all the care that they need, put all of us at risk? Because, people intermingle, people interact with each other, and HIV and AIDS essentially doesn't care whether you're South African or you're an illegal migrant or you're a legal migrant or you're from the SADC region or you're from whatever part of the continent or the world. What are your thoughts? Our studio line is 0116800355, or you can give us a WhatsApp message or voice note on 0617660355. Very, very important, and I think concerning if turn of events, and looking at the current state of the country, and organizations like Operation Tutula, March and March, and various political parties, Patriotic Alliance and Action SA, all saying that illegal migrants should not be getting any kind of treatment from our public health sector. So yeah, I'm sure we'll be having these kinds of conversations for a long time, especially considering the fact that the NHI is also being looked at quite carefully. It's being scrutinized, and it has so many layers to it. And one of those is the issue of undocumented migrants and whether or not they get the full access to our health system. So yeah, really interesting times ahead, and you can stick around to Salam Media. We'll be giving you all of those conversations from a wide range of experts who'll be breaking it down for us in the simplest of forms. We're going to take a quick break. When we come back, we'll be having our hashtag Africa Focus feature, and we'll be focusing on Darfur and the rest of Sudan.